Good morning, students. Today we are going to discuss about another interesting topic, that is eyes and respiratory system. Just by examining the eyes, we can get a lot of clues in which they are related to the respiratory system. So as I already said, the patient with respiratory system may come with any complaints like cough, breathlessness, wheeze, but each and everything has got some clue with systemic things. Example, last class we discussed about hands and respiratory. Similarly, we are going to see about the eyes and respiratory system. So I'm going to discuss you the important eye findings and in what way they are related to the respiratory system in a very short manner. Number one is ptosis. We know what is ptosis. It is nothing but the drooping of eyelids. So the ptosis may be either unilateral ptosis or bilateral ptosis. So the both eyes are drooping, that is bilateral, and only one eye is drooping, that is unilateral. Okay, in what way is unilateral ptosis related to the respiratory system? If a patient is coming with complaints of cough, weight loss, loss of appetite, and he is having a unilateral ptosis, I will definitely think of, and if he is a smoker, I will definitely think of one important diagnosis that is called as Pancoast tumor. Pancoast tumor is nothing but the superior sulcus tumor. It is also known as the apical lobe tumor, also known as the Pancoast tumor. This Pancoast tumor is nothing but the Pancoast syndrome. It will constitute the Pancoast syndrome. So what is a triad of Pancoast syndrome is? It is a triad of three things. Number one, Horner syndrome. Number two, there is a pain along the inner aspect of the arm. Number three, there is the hypothenar muscle wasting. So these three are the triad of the Pancoast syndrome. So if the patient is having an ptosis, I will think of the Pancoast tumor. In Pancoast tumor, there is something called Pancoast syndrome. In Pancoast syndrome, Horner syndrome is a component. What is the triad of Horner syndrome? It is a triad of ptosis, ipsilateral partial ptosis. Number two is meiosis. Number three is anhydrosis. So this is how is the unilateral ptosis related to the respiratory system. That is nothing but the Pancoast tumor. Then there is one more thing called as bilateral ptosis, where there is a ptosis of both the eyelids. So if a patient is coming to me with bilateral ptosis and that patient is unresponsive or not consciousness, I will be thinking of two things. Immediately I will do an ABG for the patient, and if the ABG is having a PCO2 retention, that is carbon dioxide retention, then I will be thinking of a type 2 respiratory failure. So type 2 respiratory failure and bilateral ptosis. What are the causes? Very important cause, myasthenia gravis. Myasthenia gravis patients, nothing but they are having an autoantibody against the acetylcholine receptors. So it will cause the weakness of the extraocular muscles and they will be having the ptosis. When this is involving the respiratory muscle, what will happen? There will be hypoventilation. If there is hypoventilation, what will happen? Patient will have carbon dioxide retention. If there is carbon dioxide retention, that is nothing but the type 2 respiratory failure. Okay. So myasthenia gravis. One more important cause of bilateral ptosis and respiratory failure is snake bite. Many patients at the night time they come, okay, they will be bitten by a neurotoxic cobra or some crate and they come to us with a severe respiratory failure. They'll be having a very high PCO2 retention. Then please think of a snake bite. So bilateral ptosis, respiratory system, think of respiratory failure. Okay. Then after this ptosis, the second thing which we are going to discuss is the flectin. Okay. Flectin is nothing but it's a conjunctival nodule. Okay, it's a type of conjunctivitis, flectonular conjunctivitis. So how there will be in this conjunctival part, there will be a nodule and surrounded by an area of hyperemia. Okay, so a nodule surrounded by area of an hyperemia. So if there is a flectonular conjunctivitis, what I will think of? I will think of tuberculosis. Patient has got it is nothing but the hypersensitivity reaction to the endogenous tuberculous antigens. So I will definitely think of tuberculosis if there is a flectonular conjunctivitis. It is very common in India. Okay. Third, I and RS. Third thing, SCH, subconjunctival hemorrhage. So a patient is coming to me with chronic cough and he's having a subconjunctival hemorrhage in eyes, no doubt. Okay, so it is one of the complication of chronic cough. The patient is coughing. Whenever you are coughing, the intraocular pressure rises, the intrathoracic pressure rises, the intracranial pressure rises. So when the patient coughs, there will be a rise in the intraocular pressure. So that is leading to the rupture of the small vessels of the eyes, and that is called the conjunctiva, and which is causing a subconjunctival hemorrhage. What will you do to this patient? Don't do anything. Okay, just try to suppress the cough. It will resolve on its own. It is a self-resolving condition, right? So 3 is over. Number 4th, allergy. Patient comes to us with complaints of, sir, I'm having too much itching in eyes, too much watering in eyes. That will be one complaint. Sometimes patients come to us with complaint of recurrent sneezing. Patient comes to us with complaint of wheezing. So sneezing, wheezing, watering, all are linked in one. That mother is called as allergy. So allergy can present with anywhere, in skin in the form of eczema, in the eyes in form of allergic conjunctivitis, in the nose in the form of allergic rhinitis, in the lung in the form of asthma. So all comes under one thing called as allergy. So I think that you understand. So if a patient is coming with watery eyes and redness of both the eyes, I will definitely think of allergy in this case. And if there is an allergy, in what way it is related to the respiratory system, I explained to you allergic rhinitis and asthma. This is called as one airway, one disease. They saw one airway and the one disease. The common disease is allergy. Okay, so this is one of the famous question for the examiners. They ask you in the Viva question, what is one airway, one disease? MD pulmo patients, MD pulmo students can expect this question. Okay. Next I and RS finding is pallor. This is very easy. Pallor, where we see look for pallor in the lower palpable conjunctiva. If this part is pale, then that is called as pallor. Pallor and respiratory system, what will you think of? I'll be thinking of tuberculosis. I will be thinking of lung cancers and other chronic lung diseases. So you will be having a pallor in respiratory system. Next, icterus. Icterus, you already know what is icterus. We already discussed in the previous class. It is nothing but the yellowish discoloration of the skin and the mucous membrane, which would increase amount of the bilirubin. Okay. So icterus and respiratory system, what way it is related? Okay. Icterus and respiratory system. Number one, what we can think of? We can think of anti-tuberculosis drugs. Anti-tuberculosis drugs induced hepatitis. AKT induced hepatitis. So what are the causes? What are the drugs causing in hepatitis? Pyrazinamide, then followed by the rifampicin, then followed by the isoniazid. All three are hepatotoxic drug. Most hepatotoxic drug is pyrazinamide. Most hepatotoxic drug is pyrazinamide, followed by rifampicin, followed by isoniazid. These are all important MCQs in NEET exam, right? So I'll be thinking of AKT induced hepatitis. First one. What else can be causing an icterus and in respiratory system? Why can't we think of an cor pulmonale? Cor pulmonale is nothing but the right heart failure secondary to the lung pathology. Okay, so the lung like ILDs, COPDs, they can cause a right heart failure. If there is a right heart failure, what will happen? There will be increase in JVP, there will be bilateral pedal edema, there will be ascites, and there will be congestive hepatomegaly. So when there is a congestion in the liver, there will be a raised amount of bilirubin. So patient can present to you with icterus. Okay. Any other cause of an icterus and respiratory system? Definitely we have to think of lung malignancy with liver metastasis. Lung cancers metastasis to some important organs. One is adrenal, which is most common. Followed by that we have got liver. Followed by that we have got bones. We have got brain. Okay, brain usually small cell carcinoma metastasis to the brain. Okay, so we have to think. And any other cause of icterus with respiratory system, I will be thinking of tuberculosis, disseminated form of tuberculosis. So icterus and respiratory system, please remember the four important things. Number one, AKT induced hepatitis. Number two, cor pulmonale. Number three, disseminated tuberculosis. Number four, lung CA with the liver mets. Right. Right. Next eye finding is vitreous hemorrhage. Vitreous hemorrhage, you would have read in Ophthal, third year, one very important question, Eales disease. Eales disease is also called as periphlebitis retinae. Periphlebitis retinae. It is because of the tuberculosis. Okay, so tuberculosis, we are in India. Tuberculosis is very most common. It is a respiratory disease. This tuberculosis involvement of the veins of the eyes, it suddenly ruptures, and when the vein ruptures, the vitreous is filled with the blood. Okay, so it is one of the cause of sudden loss of vision also. Okay, vitreous hemorrhage you will be having, and that is called as periphlebitis retinae, which is due to tuberculosis. Okay, fine. Next, the eighth eye finding and its relation to respiratory system, it is episcleritis. Okay, so episcleritis and scleritis, they both are very commonly seen in autoimmune conditions like rheumatoid arthritis. Okay, rheumatoid arthritis, SLE, Sjogren's, they all have an episcleritis. Okay, so if you are having an episcleritis, rheumatoid arthritis, what lung complication do you expect? We have to think of interstitial lung disease, ILD. So episcleritis, patient is having episcleritis, is coming to you with breathlessness, you are keeping a step, you are getting a bilateral basal Krebs, fine inspiratory. And what respiratory thing you have to think of? I am thinking of ILD. Suppose you are having a dry eyes is seen in Sjogren's. Again, it is involved to the lung in the form of ILD. So they're all interlinked in a very beautiful manner, my friends. Okay. Then next, number 9, keep nodules. Okay. So these are all are Ophthal MCQs. Our HOD often asked when I was in third year. So where do you get this keep nodules and Basaka nodules? Keep nodules and Basaka nodules are seen in sarcoidosis. Keep and Basaka is seen in sarcoidosis. These are the iris nodule which is present in the iris. Okay. So this keep and Basaka nodule seen in sarcoidosis. Sarcoidosis is what disease? It is a multi-system disease. Which organ is mainly involved? Our lung. What is the presentation in the lung? Bilateral hilar lymph nodes. Then you have got a parenchymal involvement. Okay. So sarcoidosis, just by eye you can find the patient is having a sarcoidosis, right? This is the 9th point. Number 10. Papilledema. Okay, so papilledema, it is a sign of a raised ICT, we all know that. And in respiratory system, papilledema, what way it is like? You are seeing the fundus, and if there is a papilledema, think of CO2 retention, carbon dioxide retention. If carbon dioxide retention, what is the cause? Type 2 respiratory failure. So type 2 respiratory failure can have papilledema. Number 1, tuberculous meningitis. Tuberculosis going to the brain. Patient will be a case of pulmonary tuberculosis. Suddenly there will be altered consciousness, and you are seeing the eye. If there is a papilledema, please think of TB meningitis. And even if his patient is having a miliary TB, in eye you can find one thing. What is it called? MCQ, choroid tubercles. Choroid tubercles is seen in the eye in case of an miliary tuberculosis. Okay. Next, number 11, optic neuritis. Optic neuritis and its relation to the respiratory system. Very nice, very important question. In tuberculosis, we read about pyrazinamide. I said about rifampicin. I said about isoniazid. One drug is there. Ethambutol. Ethambutol, important side effect. We have read in pharmacology. What we have read? Optic neuritis. Ethambutol induced optic neuritis. It is oculotoxic. It causes red-green discoloration. Okay, red-green discoloration is a optic neuritis which is caused by ethambutol. Okay, so you see how many things we can find just by examining the eyes. So don't just think if it's a respiratory case, patients come with cough, with breathlessness, nothing, no role of any systemic examination. Our importance, if you are a good pulmonologist, you should be good in systemic examination. When you examine all the parts, each and every part may give to you a clue. By just seeing the eyes, please see how many points and come to a diagnosis. I will just give a recap, what eye finding and what diagnosis, and with that we'll conclude the talk. It's going more. Okay, ptosis, unilateral, bilateral, unilateral, Pankos tumor, bilateral, type 2 respiratory failure. Flecten, tuberculosis. Subconjunctival hemorrhage, chronic cough. Allergic conjunctivitis, allergic rhinitis, asthma. All one airway, one disease. Failure, I will think of lung carcinoma, I will think of tuberculosis. Icterus, I will be thinking of AKT-induced hepatitis. Cor pulmonale, lung cancer with liver metastasis. Okay. Vitreous hemorrhage, that is nothing but periphlebitis retinae seen in tuberculosis. Episcleritis, rheumatoid arthritis, ILD, dry eyes, Sjogren syndrome causing ILD, Keep nodules, Basaka nodules in sarcoidosis, papilledema, type 2 respiratory failure, optic neuritis, ethambutol induced. Okay, so friends, I hope this video has been useful to you. Eyes and respiratory system, so don't just neglect opthal. Okay, please involve opthal also with the respiratory. We need all the system together. Thank you. We'll meet you in another video.